Hi guys, welcome to OSCE with Ghazal. So today my video will be focusing on some questions that are from one of my friend that's who is preparing for OSCE exam. I will just start answering them one by one. I thought I should make a video so that will help every other student who has these questions in mind. So let's solve those questions together. So question number one is for OTC station, over the counter one, do we need to ask red flags along with a symptom? I'm just posting her question right as it, or just red flag, then medical history, then counseling, then in monitoring, provide non-form. So that was her question. Basically, I understand that you want to know what will be the scheme if there is OTC question, that how she will be going along. So I will go with my suggestion. In each question, I will take an example so that you guys will understand more better. You will be understanding better. So here I am taking an example of, for example, counseling on a decongestant. So decongestant pseudoephedrine. Patient walk in with the concern that they have a stuffy nose, something for a sinus they are looking for. So first you listen to their concern, then doing same that this is a private area, confidential, but you will ask question about their medical history the same. So if they are allergic to anything, if they have any medical condition, if they have any, they are using any drugs on regular basis, and then you will go along with the lifestyle question even, right? Because you will see that what's causing that thing in, especially in case of allergy, if they are asking you anti-allergic, then they have to avoid those allergens. Sometimes they are allergic to pollen that cannot be obviously avoided, but mask, or you will do the management question accordingly, like the management non-forms accordingly. So in this case, you will ask, are they allergic to anything? After acknowledging that it's a private area, then you will ask about their medical history, then you will ask about the drug history they are using, and then their lifestyle. In this case, for example, the patient is using blood pressure medicine or is hypertensive. So what you will do is, like, you will not give them pseudofed, then you can give them some topical oral topical nasal decongestant that they can use for 1 or 2 days, and advise them about their side effect, and then you will go about the drug. So here the red flag was they are hypertensive. So you will, once you are asking their medical history, you will get to know, oh, that's a thing, right? And then you will counsel. So this should be the scheme, always the same, with no matter it's a OTC station or just a regular drug or any management. Then next question my student or my colleague has, or my friend has, in counseling station, always we need to assume no drug interaction or when it's stated in the station itself. Never ever just assume. If there is written that there is no drug interaction, then don't bother yourself that there should be a problem with a drug interaction. But if it's not written, always make sure. And you will get this idea when you are taking their medical history after that medical condition. If they are using any medication, then always check for the main interaction that are always on our top of the head. Also, especially if they say, yes, we use OTC, for example, I'm just quoting an example like garlic and hypertensive, so you can just give yourself an idea. Here I quote the example of antibiotic and birth control. For example, you were taking the history and you get that she is on birth control, and today you are dispensing antibiotics, so you will definitely counsel them that birth control efficacy can be decreased with this antibiotic, but since you have infection you need antibiotics, so you make sure that you are using a backup method for 7 days or during the course of therapy. Next question. So question number 3 is, in monographs, warning and precaution is a part of side effect or drug interaction or both. So to make it simple, I will say that it's not a part of side effect, not a part of drug interaction, or not a both. So basically, when you take medical history, very important to take complete patient history, because when you take patient medical history, you will identify that. And obviously, whenever you have given the monograph, go to warning and precaution is not that big. This is the part that you will, for example, here I am quoting Ramipril in pregnancy, right? And I quote the same from the what you call RxTX, the warning. So this is a big no-no. So when you were taking, you obviously patient presented with the prescription of Ramipril. When you were taking history, then you realize that she is 35, she's pregnant, and she brings the prescription of Ramipril. So obviously you will not go to side effect, you will not go to drug interaction of the drug, because you are not dispensing the drug. So here you will stop and you will say, since you are pregnant and this drug is teratogenic or not good for the, not contraindicated in pregnancy, I will ask your doctor to change it. So warnings are something that once you are reviewing their history and you identify if there is a big no in warning. Most of the time when there is a warning, there is a big no, or something related to the, in for example, what you call statins, their myopathy, very severe muscle pain. So obviously they have to stop taking drug. Then you can quote in the side effect, but it depends of the on the type of warning, what kind of. If you have more question, then you can more question regarding this, or am I not clear, you guys can always post in comments, and I will try to make a new video on that, or make try to make it clear with example. Even though if you want me to solve a case, I am more than happy to do that. Just give me a case and I will try to solve it on completely, so you get the idea what points to cover. Because basically OSCE is not that hard, you just need a practice. Plus, if you are doing the safe practice, you are not putting the patient at risk. If you are unsure of anything, don't assume, don't assume. Just then in that case, if you don't realize, just say, I will contact your doctor, or I need some more time, I will get back to you, I will call you later. Just finish the case like that, but never ever assume and give your suggestion, because sometimes you put the patient at risk, and that's a big fail. Next question, and that's the last, I guess. So in management cases, is there any scheme or just answering the concern? Management case depends. So if the student who asks me, I would say, give me a case what you mean by management. But I am taking here, for example, the technician and counseling. So if a patient came in and they ask a question from technician, so technician has to send them to the pharmacist, because they can say that pharmacist will be able to help you. I'm not the authorized person, because that's not under their scope of practice and they are not licensed to do so. In this case, management, for example, the technician is with you and you are guiding them, not to counsel. So you will ask them that you are always start with praising them first, and then you will bring your concern later. I really appreciate your hard work for pharmacy, and patient also appreciated this, that, and then you will say, but only one concern I have. So I hear that you are counseling the patient. That's only pharmacist can do. So make sure that whenever someone comes, just ask the pharmacist to do it, and that's all. This is how you